There is a condition that medicine has struggled to name for decades. It does not appear on blood work. It produces no definitive scan result. But it presents consistently as a cluster of symptoms millions of older adults know well. Fatigue, that sleep does not fix. Chronic low-level pain without clear origin, digestive disruption, mental fog, and an emotional flatness that seems disconnected from anything actually happening in life. Most people who live with this pattern have been told, after extensive testing, that nothing is wrong. What has not been told to them is what research is making increasingly clear. Their nervous system is dysregulated, and it has been for a very long time. Nervous system dysregulation is not a diagnosis in the conventional sense. It is a physiological state, one in which the autonomic nervous system has become chronically biased towards sympathetic activation, the branch responsible for threat response, at the expense of parasympathetic recovery, the branch responsible for repair, digestion, immune function, and rest. In a healthy system, these two branches alternate fluidly throughout the day in response to actual conditions. In a dysregulated one, that flexibility is lost. The threat response stays on regardless of whether any actual threat exists, and the body shows the consequences of trying to sustain emergency mode indefinitely. Dr. Stephen Porges, whose polyvagal theory reshaped the neuroscientific understanding of autonomic function, documented how sustained emotional stress, accumulated over decades of suppressed feeling, unresolved loss, chronic self-silencing, or living in environments that felt persistently unsafe, produces measurable and lasting changes in vagal tone, the primary marker of parasympathetic capacity. Individuals with chronically low vagal tone show a predictable and consistent cluster. Poor sleep quality, heightened pain sensitivity, impaired immune response, digestive irregularity, and significantly reduced emotional resilience. These are not separate problems. They are the same problem expressed in multiple body systems simultaneously. Research published in Frontiers in Psychiatry demonstrated that dysregulated autonomic function in older adults is significantly associated with cumulative emotional stress carried across the lifespan, not just recent stressors, but the long-term weight of experiences that were never fully processed. The body that carried anxiety for decades, absorbed losses without space to grieve, and performed composure through years of internal chaos arrives at 60 or 70 with a nervous system that cannot downregulate without deliberate and consistent support. What research consistently shows helps is not medication targeting individual symptoms, but practices that directly restore vagal tone. Slow diaphragmatic breathing, practiced for as little as 10 minutes daily, has been shown in multiple controlled trials to measurably increase heart rate variability, the primary physiological marker of parasympathetic recovery, within 4 to 8 weeks. The nervous system that learned to stay in high alert can learn, with the right conditions and patient practice, to finally stand down. You're not falling apart. Your nervous system is exhausted. Those are genuinely different things. If this video resonated with you, take a second and hit that like button. It helps more people find this content when they need it most. Subscribe so you never miss a new video, because every week we bring you research-backed insights to help you feel more like yourself again. And if you know someone who might need to hear this, a friend, a parent, a sibling, share it with them. Sometimes the most caring thing we can do is pass along the right words at the right moment. I'll see you in the next one.